All right, so, you know, let's dive into something we don't usually chat about over coffee STDs.
Yeah, not exactly light dinner conversation, right? But it's definitely something we should all, be informed about.
Absolutely. And you've brought some really interesting information from the Washington State Department of Health to help us really deep dive into this topic.
Definitely. And it's not just about knowing the basics, it's about understanding the nuances that often get overlooked.
Okay, so let's start with the basics. Just how common are STDs?
Mhm.
Because this report makes it seem like they're, well, kind of everywhere.
It's more widespread than a lot of people realize, that's for sure. The data actually shows about 1 in 4 young adults has an STD.
1 in 4. Wow. That's a lot higher than I think most people would guess. That's kind of alarming, honestly.
It is concerning, yeah, especially when you consider that this number likely just scratches the
I
surface.
mean, there are even more cases out there.
Exactly. The reality is that many STDs fly under the radar because they don't always, come with flashing neon signs.
So you're saying you could have an STD and not even know it? Like no itching, no burning, no telltale signs?
It's more common than you might think, and it's one of the reasons why regular testing is so important, even if you feel perfectly healthy.
Okay, this is where things get really interesting, and I'm already sensing a myth about to be busted. So you're telling me I could have an STD and not even realize it? No, like no itching, no burning, no obvious signs.
Yep, that's right. It's more common than you might think, which is why those regular checkups are so important. It's like going in for a dental cleaning. You might not feel any pain, but that doesn't mean there isn't an issue lurking beneath the surface.
So if someone is listening and thinking, wait, how would I even know to get tested if there are no symptoms? What should they watch out for?
That's a great question. Well, while a lack of symptoms doesn't automatically mean you're in the clear, the source does mention a few red flags to be aware of. Things like any unusual discharge, an unexplained rash, a burning sensation when you pee, or, any bumps, sores, or warts in your genital area. Those are all things that should definitely prompt a visit to the doctor.
Right. So those are some clear signs to look out for. But let's talk about condoms for a second. I feel like we're always told they're the ultimate shield when it comes to STDs.
Well, condoms are definitely important when it comes to preventing STDs. Absolutely. They act as a barrier, right? Blocking the exchange of fluids that can spread infections.
Right.
But, and this is a big but, they're not 100%
Wait,
guaranteed.
really? I thought condoms were supposed to be like super effective. You're saying they don't protect against everything?
They're highly effective for many STDs, but there are some exceptions. You see, condoms primarily protect the areas they cover, but some STDs can be spread through skin-to-skin contact, even if a condom is used perfectly.
So even with a condom, there's still a possibility of contracting an STD.
Mm,
Huh. That's kind of a game changer for how we think about protection.
right. And it really highlights the need for those open and honest conversations with your partner about sexual history, testing, all of that.
Okay, so condoms aren't a foolproof shield. What about abstinence? Is that the only way to be completely safe?
The source does mention abstinence as the most certain way to avoid STDs. However, we also have to acknowledge that it's not always a feasible or realistic option for everyone.
So if someone is sexually active, what steps can they take to protect themselves, especially knowing that condoms aren't a foolproof guarantee?
Well, it boils down to two crucial things: open communication and regular testing. They might sound like simple solutions, but their impact is significant.
I've got a feeling you're about to drop some wisdom here. It's all about communication, isn't it?
It really is. Having those frank and honest conversations with your partner about sexual history, any concerns you have, and getting tested together, it can make a world of difference. It's about being on the same page and prioritizing each other's health.
And when we say regular testing, what does that actually look like in practice?
Think of it like any other important health checkup. Talk to your doctor about a testing schedule that's right for you, even if you feel perfectly fine. Many STDs don't, wave a big red flag, so regular testing is really the most reliable way to know for sure.
This actually reminds me of a question someone sent in. Can you get an STD even if you're a virgin? What are your thoughts on that?
That's a really insightful question, and it highlights why it's crucial to be clear about what we mean by virginity. The source emphasizes that STDs can be transmitted through various forms of sexual contact, not just intercourse.
Okay, so someone could technically be a virgin in the traditional sense, but still be at risk for an STD. That's important to clarify.
Yeah, for example, someone might consider themselves a virgin if they haven't had, say, vaginal intercourse, but maybe they've engaged in other forms of sexual activity, like oral or anal sex, which can also transmit STDs.
That makes sense, yeah. It really underscores why having those open and honest conversations with your partner about what you both consider sex is so important. And to add another layer here, the source also mentions that some STDs can be spread even without penetration, just through skin-to-skin contact.
Exactly. And that's why it's so important to understand how different STDs are transmitted. It all circles back to having open and honest dialogues with your partner.
Okay, so we've established that communication is key, and that condoms, while definitely valuable, aren't a foolproof guarantee. But let's say someone does test positive for an STD, what happens next? What's the course of action?
Well, first and foremost, it's important to remember that a positive test result isn't, the end of the world. Many STDs are totally treatable, and even those that aren't curable can often be effectively managed with medication.
Okay, that's somewhat reassuring. But what does taking action actually look like after you receive a positive result?
The most important step is to follow your doctor's guidance really carefully, like complete the full course of any prescribed treatment, no shortcuts. And it's equally crucial to inform your current and past partners so they can also get tested and, if needed, treated.
I imagine those conversations about STDs with past partners could be, well, kind of daunting or awkward. How do you even begin to navigate that?
It can be a sensitive conversation, for sure, but it's an act of responsibility and care for yourself and for others. The source even addresses this, highlighting that getting an STD doesn't automatically mean your partner cheated. It's not always a black and white situation.
That's a really important point to make. So even in a committed relationship, you could still contract an STD. I think a lot of people might assume they're off the hook if they're in a monogamous relationship.
It's definitely possible, especially if one partner had a previous sexual relationship where they were exposed, even if they never experienced any symptoms themselves. STDs can actually lie dormant for years, and transmission can occur even without someone knowing they have it.
That's a good reminder that regular testing is so important for everyone, even in long-term relationships where you think, like everything about each other's history.
Absolutely. It's a health practice that should be part of any healthy relationship, no matter the duration or level of commitment.
Switching gears a bit, let's talk about oral sex for a sec. There's this common misconception that you can't contract an STD through oral sex. Is there any truth to that?
Unfortunately, that's a myth that needs to be debunked. The source explicitly states that contracting STDs through oral sex is definitely possible.
So it's not just about protection during intercourse. It's about being mindful of all forms of sexual contact, right?
Exactly. The source specifically mentions gonorrhea and herpes as examples of STDs that can be transmitted through oral sex, just like through vaginal or anal sex.
Good to know. And what about the connection between drug use and STDs? Is there a link?
Yes, there can be. The source highlights that sharing needles for intravenous drug use is a significant risk factor for transmitting certain STDs, particularly HIV.
Right, that makes sense. You're sharing bodily fluids when you share needles, which is a primary way STDs are spread. What about drug and alcohol use more generally? Like, if someone is under the influence during sex, does that increase their risk?
That's another point the source cautions against. Being under the influence of drugs or alcohol can impair judgment and increase the likelihood of risky sexual behavior, which in turn can lead to STD transmission.
Basically, being intoxicated can lead to the decisions you might not make otherwise, like having unprotected sex or sex with someone you wouldn't typically choose to.
Exactly. It's always about being aware of the risks involved and making conscious, responsible choices, which includes being mindful of your state of mind and how it might be influencing your actions.
This deep dive is really eye-opening. Before we move on, I have one more question based on something I hear a lot. Are cold sores considered STDs?
That's a great question, and the answer might surprise some people. Yes, cold sores are caused by the herpes simplex virus 1, HSV1, which is considered an STD. They typically appear on the mouth, but they can be transmitted to the genitals through oral sex.
So even something as common and seemingly harmless as a cold sore can be an STD and needs to be treated with the same seriousness.
Absolutely. It goes back to understanding how these infections spread and taking precautions to protect yourself and your partner.
This has been like such an important conversation. We've covered so much ground.
Yeah.
From busting those common myths to really emphasizing the power of open communication and regular testing. It's amazing how much valuable information is out there, and knowing it can truly empower us to make healthier choices.
Absolutely. And, I think it's important to address one more question that I find often comes up, and that's this idea of getting an STD more than once. There's sometimes this misconception that once you've had an STD and been treated, you're home free.
Yeah.
But that's not always the case, is it?
Right. I think a lot of people might just assume it's Like getting chickenpox, you have it once, and you're immune.
Yeah.
So you're saying that's not necessarily true for all STDs.
That's right. The source is very clear that bacterial infections, things like chlamydia, gonorrhea, syphilis, those can be contracted multiple times, even if you've had them before and gone through treatment.
So even if you've been treated for a bacterial STD, you could still get it again later.
Exactly. While treatment takes care of the existing infection, it doesn't mean you can't be exposed again in the future. That's why, again, consistent safe sex practices are so crucial, even with partners you've been with before.
It all goes back to what we've been talking about, right? Communication, protection, regular testing, they all matter no matter what.
It's about establishing those healthy habits that protect both you and your partner.
This has been such an eye-opening deep dive. It's kind of wild to realize that STDs are a lot more common than we often think. But, with the right knowledge, we can approach our sexual health with so much more confidence and responsibility. So as we wrap up, what's the one thing you really want listeners to take away from today's conversation?
If there's just one thing to remember, it's this. Getting tested is an act of taking care of yourself. It's a simple step, but it can bring so much peace of mind. And as you mentioned earlier, the Washington State Department of Health website, that's a really great resource for anyone looking for testing locations in their area.
It's easy, confidential, and so empowering. Knowledge truly is power, and I think we've all gained a lot of it today. If this conversation has got you thinking, just remember that taking care of your sexual health is something to be proud of. Until next time, everyone, take care.